71 years old, Larry Morrow lost a 6-year-long battle with prostate cancer. He tried many different kinds of therapies, chemotherapy, radiation pills, and even had over 10 surgeries, but nothing seemed to stop the cancer from spreading. Doctors are noticing this with more patients than just Morrow. Doctors want something more effective because 1.7 million Americans develop cancer each year, and 580,000 people die from it annually. It's the second most common cause of death in the United States. So they're leaning towards a new treatment called nanotherapy or nanotechnology, which is very new and still developing. Doctors are leaning towards this because it's more effective, has less side effects, and there's many ways to use it. However, the cost is very high. So what is this cancer treatment that almost sounds too good to be true? Well, it's technology that allows for the applications of medicines, structures, and devices into the body more effectively. The particles in this technology are very small. They're 5 to 100 nanometers in size, which is about half the size of a typed period on a computer screen. This small size allows for easier movement throughout the body. So why should we choose nanotherapy over one of the most popular treatments for cancer, chemotherapy? Because the drugs in nanotherapy go straight to the cancer cells and less goes to the healthy cells, while drugs in chemo tend to go everywhere. According to Andrew Tokas, Associate Professor of the Bioengineering Department at the University of Pennsylvania, one of the main issues for current chemotherapies is that they distribute non-specifically throughout the body and you end up with adverse effects. With chemotherapy, doctors can't control where the drug goes, so healthy cells get the same dose as tumor sites. You also should use nanotherapy instead of chemotherapy because the particles in nanotechnology travel only to one area, so there are less side effects. When injected, the particles go to the tumor and straight to the membrane and right to the core. This blocks all the chemical signals, not allowing the cancer tumor to grow. Nanotechnology also allows there to be shorter treatment time. Helen Townley from the Department of Engineering Science at Oxford University says that if we can get the nanoparticles into tumors where normally you wouldn't be able to crank up the radiation high enough without severely harming the patient, we have the potential for a lower dose or a shorter course of treatment. Nanotechnology can be used in many ways. Here are just a couple of the most popular. Active targeting. In this, the drug goes directly to the cancerous cells, and the laser is used to stimulate the drug release. The light of the laser allows us to see where the drug is going, and if the nanotechnology is going to the wrong spot, the doctors can control the nanoparticle to not release the drug. There's also heat therapy, which is very similar to laser therapy. It was done by Jack Hoops at the Norris Cotton Cancer Center. He injects iron oxide nanoparticles into the tumor with the goal of slowing the tumor growth and eventually killing it. When heat is applied, the drug is released. There is little to no damage to surrounding healthy tissue. Another way is called magnetic nanotherapy, which is also done by Jack Hoops. He first used this technique with mouth tumors in dogs. Iron oxide particles go into the tumors while he tried this, but there was no effect to the tumors. So Hoops decided to expose the particles to the magnetic field. He had great success, and the tumors disappeared after 2 weeks. Since he had success in this, he decided to try it on breast cancer. There's 2 phases in this. In the first phase, he examines the tissue before therapy, and then he puts the patient through treatment. He then examines the tissue again after treatment to see if it was effective. If he has success, then he goes to phase 2, which is when he combines magnetic nanotherapy with radiotherapy, with the goal of ridding the tumor without any need for operation. He tried this on breast cancer because the tumors are very accessible and easily imaged and located. Breast cancer also typically tends to spread to the lymph nodes, which is where nanoparticles tend to gather when injected into the bloodstream. Although nanotherapy is very effective and useful, it's also very expensive. New technology is always expensive, and a lot of money is spent on the research for it. Manufacturing is also very costly because they must be very precise when making. They must make sure that the size, shape, and chemical balance are perfect, and it must be the same so the aggression level is correct. They also need special equipment due to the size of the particles. Mass production also costs a lot of money because they must be very careful. Within the same batch, 2 particles can differ. Even when made the same way, the chemical balance can still be off. Jennifer Grossman, scientist at the Nanotechnology Characterization Laboratory in Frederick, Maryland, claims that if nanotech therapies continue to have higher costs than their small molecule competitors, they're likely to remain controversial unless they can also show more dramatic increases in patient survival. She claims that it's just not affordable for many people. However, her partner, Scott McNeil, Grosven's partner, says that because the nanomedicines are less toxic to healthy tissue, they afford patients a significantly better quality of life. He says that if they pay for this, there's no other treatment necessary, so it may be worth every single penny that you have to pay. It's easy to see why nanotechnology has an advantage over other traditional cancer treatments because it's more effective, has less side effects, and there's many ways to use it. Even though it's expensive, there are many benefits to nanotherapy. You never know. Someday one of your loved ones could be diagnosed with cancer, and nanotherapy could save their life.